Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we are going to be talking about a topic entitled Autism Spectrum Disorder. Now, you may or may not have heard of this condition before, but we are going to be having a series on this, and this is another installment in the series of autism. Now, we're going to explain to you what autism is, but the focus of our story today is the role of family caregivers in lifelong care of people with autism spectrum disorder. Now, we're going to talk about autism spectrum disorder in some detail, but just to get going, it is a neurodevelopmental disorder. Now, what does that mean? It means that it starts in the brain. We don't know exactly when, but often these diagnoses can be made very, very early on in childhood. So it can range from 3 years old or even younger in some cases to people when they're adults. That's why it's really referred to as a spectrum. It is a very complicated disease, and we're going to be talking about how you can identify it. And we're going to also be talking about how you really cope with it. So these issues are of great importance because, believe it or not, most of you have met someone with this problem, but you may not have recognized it, and we're going to talk about how you can recognize it. Because the more that you understand, the more that you can be helpful as part of the community, if not as a caregiver yourself or a family member, to really understand and to help people with this disability, which we don't even want to call it disability. We really want to call it a disorder because that's really a better word to describe this and help us to intervene. So the person that's really going to help us with this today is Dr. Ellen Giarelli. And I'm going to introduce Ellen because she is a true trailblazer in this field. And her background is as follows. She is an associate professor in the doctoral nursing program at Drexel University School of Nursing and Health Professions. So she is helping other nurses to develop their skills in this area. And in particular, she has helped to design and is the director of a certificate program for people who are already nurses who want to know more about this problem and how to deal with it. So she's put together and she runs this program in integrated nursing care of autism spectrum disorder. And to that point, she's also written the only textbook in the country on this problem. So her book, Nursing of Autism Spectrum Disorder, is really used for nursing programs around the country. So I want to introduce Ellen and to you because I think you are really going to hear from someone who has spent a great deal of her life working with people with these problems. So welcome, Ellen.
Thank you, Nancy. It's a pleasure to be here. It's really my pleasure to be here because this is such an important topic that I welcome any opportunity to introduce my work and the important work that nurses are doing with this group to the public and to talk further and develop a conversation between you and me and all parents out there.
That's wonderful. Thank you so much, Ellen, because it really is wonderful to have you with your background and experience because you understand the science in back of this problem, but you also are feet on the ground. The fact that you are even working with nurses at Hahnemann University Hospital, helping nurses to do research, just shows your dedication to really developing people in our field to be experts in this area. So yes, thank you.
Thank you.
So let's start out with just the basics. Tell us about autism spectrum disorder because a lot of people may or may not be familiar with this.
Certainly. The autism spectrum disorder is a group of neurodevelopmental disabilities, and sometimes it's called disorders, that range from quite severe, and this is autism, to less severe, which would be Asperger's syndrome, called Asperger's syndrome a couple of years back, but now that has changed somewhat. People who are diagnosed with autism spectrum disorder have a range of behaviors that interfere with their communication. They have problems talking to to individuals. They have problems engaging in conversations. They may have repetitive restrictive behaviors that, such as flapping or resistance to change. And they also have problems with social relationships.
Is that one of the cardinal signs, the social relationships?
They call these the core characteristics of the disorder. Interpersonal relationships are affected, communication may be affected, and they have repetitive and restrictive behaviors. But also people with autism have a range of other problems that interact with the core features and affect their life functioning from the time they're diagnosed all the way into their late adulthood. And they also affect these behaviors also affect families, and each person in the family reacts to the person with ASD in a different way. Some of the other problems that people with ASD have are psychiatric disorders. They have intellectual disabilities. They may have problems processing the sensory environment, and what I mean by the sensory environment is they have different ways of things feel different to them. They are hypersensitive or very sensitive to extra sounds or smells in their environment, and bright lights, like the lights in our studio, might be very disturbing to a person with ASD.
Right. So when we say that it's really neurodevelopmental, I don't think that most people would understand what that means. So can you just help us a little bit with that term?
Well, neurodevelopmental implies that something in the brain has not developed properly. And we have normal brain development, which allows us to interact with our environment in a typical way. When we touch a hard surface, we know that it's hard. When we see a bright light, we close our eyes. When we learn as we grow that people are like us, and that we can talk to them in conversation,
right, and relate to them.
Right. And that's normal development. But people with neurodevelopmental problems never develop the brain circuitry that allows them to make those connections between people and themselves, between objects in their environment, and the way they should react to them.
Right. I think it's really important for people to understand that this is a brain-based physical disorder, because when you see some of these behaviors, I think the first reaction that people might have is they should stop doing that, or they can control that, or they're just not being socially appropriate, right. Sort of what's wrong with them, meaning that they could correct this. And I guess that's really very difficult if you have this problem.
Right. And one thing that parents might be faced with is questions along that line. Why can't you stop your child from speaking loudly in a public place? And why can't they just pay attention to me when I'm speaking to them in the classroom? Teacher might ask that. And surely those are legitimate questions that a public might ask, but you're absolutely right, Nancy. The person who is diagnosed with ASD cannot overcome those social barriers. They cannot relate to their environment in the same way that we do. And truly there is no cure, as we might think of a cure in terms of another kind of disease or disorder. With ASD there is no cure. This is a disability or a developmental disorder that lasts the lifetime.
Right.
And we sometimes refer to it as a pervasive disability. And by pervasive, we mean that it pervades or integrates with every aspect of one's life. It affects the way they deal with people. It affects the way they can learn, how they experience their world. It is all-encompassing.
Right. And I think that also you're really educating us about this whole idea of it being a spectrum. They're very unusual to have a disorder that we call a spectrum, but I think that use of that term is really to try and show that there's really a very wide range of these behaviors. Now there's spectrum disorder for almost everything. I mean, heart disease has a spectrum. Some people have low-level heart disease and some people have very advanced heart disease, but we don't necessarily use that term for heart disease or cancer or any of the usual. But we're using it for this maybe because we're just trying to understand it. We're trying to really put a framework around all these very different behaviors, for which some people have low and mild, as you pointed out,
right.
And some people have very, very severe affectation of this. Their behaviors are much more pronounced.
You know, the idea of using this image of the spectrum is very smart with the autism societies and the advocates, because it helps people realize that there are no discrete points along the line of the disorder where one can say you are this or you're that or something else, where all of the symptoms and the characteristics and the behaviors, they sort of blend together in terms of the severity, so that you've heard this, some of you may have heard this said, that if you've met one person with autism, you've met one person with autism, that every individual on that spectrum is unique, separate, different in their own way. One may have a symptom that's of communication problems where another does not. So the spectrum really captures that full range, variety, and the interestingness of the spectrum itself.
Right. I think the other thing for us to differentiate is that this is not having to do with intelligence. This really has to do with behavior. Can you speak to that?
Well, yes, it mostly has to do with behavioral characteristics, communication characteristics as well, and socialization is part of that behavioral and communication component. But
the intelligence piece. I think people try to differentiate, and I think that's part of what we're doing even with parents, is as they are trying to cope with this. This is really not a person that has maybe lower intelligence.
Yes.
It is a behavioral issue.
Generally, that's true, but we have been looking at the incidence of ASD in populations for at least 10 years now. And we do find that approximately 30% of people who are diagnosed with autism also have some intellectual disability as well. And that's just 30%. It's not all of the individuals are diagnosed, but there is a certain percentage that are affected in that way. So we've also noticed, looking back in the history of the disorder, that 20, 30, maybe more years ago, when people were brought to a mental health professional for a diagnosis of behaviors that were odd, like on the spectrum, that they would measure their intelligence, because those were the tools that they had. They measured their intellectual ability. And that person might have been diagnosed with an intellectual disability, used to be called mental retardation, rather than being on the autism spectrum, because that was the most dominant feature that occurred that presented itself to the diagnostician, and where in fact they could very well have been on the autism spectrum as well.
Right. So it is complicated. I mean, it's just not easy necessarily to get this diagnosis, and now we're getting better, more refined, as Ellen is telling us, in how to even get the baseline information and get that diagnosis. But I think as we try to sort through this, the real nut to crack is really at home, in terms of how parents really are dealing with this and what they can really do to be helpful to their child. So let's talk about your experiences with parents and the kinds of advice and tips you would give people.
Well, a couple of years ago, maybe 2007 or 8, when I was at the University of Pennsylvania, we conducted a study with parents who had been who had a child who was newly diagnosed with autism. The children were between the ages of 3 and 6 years old. They had presented to a diagnostician with symptoms. Parents were suspicious. They thought something was wrong with their child, so they brought them in for diagnosis. And they were then diagnosed as being on the spectrum. And the study that we conducted interviewed the parents. We sat mom and dad down, and mostly it was mom. We sat her down and we asked her, what was it like to learn about this diagnosis? You know, what did it mean to you? What did the doctor tell you when the diagnosis was made, and so on. And what we found was not surprising, but it was very interesting. We found that parents, even though they had suspicions possibly for years before the child was brought in for diagnosis, even though they thought that something might have been amiss, when they were told the diagnosis that their child was on the spectrum, it was experienced as devastating to them.
Yes.
It created this sense of grief. As they were going through a loss of a child that they dreamed that they would have, that they were never going to have. So they experienced grief, They experience anger at this diagnosis, the sadness. Sometimes some parents felt guilty because they thought perhaps something they had done was to blame for their child having this pervasive disorder. But all of these put together meant to us that this period of diagnosis, when a parent is brought in and told that their child is affected, has to be treated in a very careful, very delicate way. We have, as health professionals, have to make sure that we prepare mom and dad for this diagnosis long before this information is conveyed. And we have to realize that the parents are going to go through a very difficult time after they learn this diagnosis, and the parents their reaction to the diagnosis will also be play itself out in the entire family.
Right, right. So, I mean, I think that of all those grief reactions, the guilt is of particular interest because how do you deal with the fact that it really isn't anything that the parent did?
Well, how does a parent deal with guilt? That's the question of the ages. Being a mother myself, I know that we look at our children and we would want their life to be perfect and everything to go well, and even the most the most benign of the problems that our children have, we look to ourselves to see what we might have done differently to assure that their life was a little bit more pleasant and easier and healthier. Right. I think that this feeling of guilt is part of being a parent. We blame ourselves for things that are not perfect in our children, and it's no different for the parent that has a child with this severe disorder.
Right. So part of the journey through all of this is to realize that no matter how you feel, it is normal, it is natural, and is part of the parent's journey to really move forward and get through some of those feelings.
Well, once the diagnosis is presented to mom or dad, and they realize that this is something that will not be cured, that is going to affect their child for the rest of their life, and affect the family for the rest of the life of the family, then that we as professionals can help them to take steps to structure the learning experience, to structure the healthcare experience, to think of the child's life in its entirety and to plan accordingly.
Right.
So that's the best time for us to step in as professionals to start and help parents to make a plan, right. To know, to try to understand in all the complexity, the limitations that might be experienced by this little young boy or girl as they grow and develop, and to make accommodations for them, to make sure that the school system knows that they have special needs, to make sure that when we visit a pediatrician with our child, that they know that this child can't be sitting in a room with a lot of bright lights or a lot of noisy other children because it'll be very distressing to them. So we help our parents then to create a life plan for the child, to make sure that it is as enjoyable, as productive, and as healthy as it can be.
Right. So I think that the good news in all of this is if you do get a diagnosis or you're a family member and someone in your family has gotten this diagnosis, it is not a life-threatening disorder. So what it really is a lifelong issue. And that's really what I think Ellen is telling us, that part of the grief process is to really come to terms with that and to get a grip on what that really is going to mean. And then the next step is to do some planning with support. I mean, people cannot plan for this completely on their own, and that's why you need a team. You need to be involved with other professional people that can really help you with that planning. So for instance, once people really have an understanding that this is what is happening to their child, the good news there as well is that we don't like labels, but labels at least give us some direction. We have some direction on what the future is going to hold. Then what? What are sort of the next steps that occur after that? After people say, okay, I don't like this, I'm very disturbed, I'm very upset myself about it, but what now can I do to help my child?
Well, there are a lot of different things that a parent could do. One of the most difficult transitions for a child is to go into formal schooling. But sometimes that transition is one of the best things that the child can encounter. Going into the formal schooling process provides that child with a kind of stimulation, there's extra services, and the caring individuals, caring educators that that little guy or gal needs to sort of develop a way to interact better with the world. So formal schooling is a very important first step. And when a child enters the school districts, whether they be private or public, usually they will be evaluated for their learning needs, and a very distinctive program will be developed. It's called the educational program that is interagency and interprofessional, and it will be designed to meet the specific learning needs of the child.
Well, that sounds very good. So most schools are really equipped to at least do that part of the assessment.
Most schools are equipped, yes, they are. And most schools, and I would say nearly all of them, certainly in the Philadelphia County, they're very well equipped. They have services available in the school districts to help with speech, to help with occupational therapy, which is being able to hold a pencil properly and writing properly, to engage the child in some group activities, and to ease them into that social network that they will be a part of for many years to come.
Right. Maybe some children that are lower down on the spectrum may not have those particular needs, but what kind of services would they get? Would they get like special teachers to help them if they couldn't pay attention in class? I mean, give us some example of people that are maybe not as affected but still have some issues.
Well, school districts will develop the Individualized educational program. It's called an IEP, and some of you may have even heard of this because it's used for any child that has special needs. But when we say individualized, it's exactly that. It's designed specifically for the very distinctive needs of that individual child. Right. So the child who is high functioning on the autism spectrum, who maybe has exquisite language skills, is reading, maybe even reading before they enter kindergarten, but has a fear of being among strangers and has difficulty communicating in conversation, then the individualized educational program might involve some careful work with counselor on teaching them skills on how to start a conversation, on how to keep it going, practicing social skills in that very secluded, very personal environments of one-on-one.
Right.
Whereas the child who is more severe on the other end of that autism spectrum has possibly difficult, maybe not communicating at all, has no language skills or very serious behavioral problems, they might receive one-on-one care with a special educator or a group of special educators in a very isolated environment, and possibly not in the public school district, but possibly in a special school.
Right. So for parents who are listening to this, it's really key that you support your child going to school and having a mainstream life, because it is very good to hear that the schools have these services available, and that they are going to individualize the treatment, so to speak, for the educational needs to be met in something that will fit your child. And you can be part of that conversation.
Well, I'm actually so glad that you raised that point, because the way I see it, and the way my nurses who are in my program see this, is that we believe that mom and dad are the principal advocates for their child. They are the point people for getting the services that child needs, for making sure that all these services are delivered properly and on time, and for really being the main supportive person in the life of that child who is affected. So not only are parents going through this difficult time of learning the diagnosis and dealing with these complex feelings that are associated with it, but they're also given the task of being the main advocate for their child's success.
Right.
And it's a very important role, and it is, and from my experience with working with and talking to moms and dads of children who are affected, parents embrace this role because it brings them closer to their child. It keeps them intimately involved in those activities that work best to make sure
Right.
that their child is successful, and we as nurses help them do that.
That's wonderful. I think that's so encouraging, and that is really the purpose of this show, is to be encouraging and supportive, for you to really find out what those services are. Once you find out what they are, to engage in a very key role with the people that are delivering these services in places where you can't be. And it's also very encouraging to hear from Ellen that with the proper support, parents are playing that pivotal role in a way that no one else could. Nobody else can really do what you can do for your child. And it's still very, very important for your child to have you as their advocate and as their buffer to some of the world that they cannot deal as effectively with. But you had that feet on the ground experience that I mentioned earlier. Give us an example. I know you shared this toolkit idea of something that parents could do for the younger child, or maybe even older children, as they have to go out and encounter some difficult situations. Give us an idea of what parents can do to really be proactive and help them get ready for such experiences.
Well, one of the things that we talk about with families and about their children are these points of change, these transition periods in their life, and a transition could be major transitions like going to school.
Right.
It could be minor transitions like getting in the car.
Right.
And going to the grocery store.
Right, let's look at that toolkit, because that was a very concrete example.
Yes, and I mention these transition points because the toolkit that you're referring to is a way to help to facilitate these changes from one environment to the next, going to a doctor, going to a dentist. And we often need some devices, some assistive devices, to help the little boys and girls who are on the spectrum to do different things, to make what I call transitions in their life, to go to the grocery store, for example. So we advocate for parents to develop what we call coping kits. And these are little composites of devices.
Right.
Materials, pencils and pads, scripts that describe an event, objects to play with if it's a young child, that can be put in a bag and used and taken with you whenever you need to do something new. And maybe we can pull up a
well, I think what we're going to do is we're going to look at this coping kit, and we're just going to show you that for a moment there are things that you can put together. There's like little scripts that you can write. There are some toys here, taking familiar toys that the child is familiar with, things that even flashcards, like you can give them little flashcards so that they can communicate to the dentist or the doctor what they really would like to do. But I really want to say that we're going to have this on the website so that people can see it and really appreciate the work that has gone into designing this just as a model. You can certainly customize this to your particular circumstance. As you can see, there are so many aspects to being a parent of a child with this condition. And this is just the tip of the iceberg on our series to really look at autism spectrum disorder. The goal of this series, which Ellen has been very instrumental in helping us put together, is really to educate you, the public, on this condition. It is more common than most people really understand, and we want to really raise your awareness, and I think Ellen has done a masterful job of that today. Raising awareness and also giving you direction and tips where you as a parent or as another family member can really understand that you are going to be supporting and helping this family and this child so that they can have the best quality of life that is possible. And it is possible. What I think, in closing, Ellen, I would like to just say is how much I admire your work and of your colleagues and everyone that's working with this field. In my very young training, before I was even finished with my college degree in nursing, I spent time at a state hospital in Pennsylvania. And in that population of young children, there were people with severe autism. And they were basically dropped off for a lifetime. in an institution where they would not have the quality of life that we're talking about today. So I want to thank you for being with us, listening to this really important topic, and I hope you have something that you can take away that you can learn. Thank you so much for being with us. And remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.